Welcome to Medication Administration Training, Module 3.
Administering medications safely. The 7 rights of medication administration. The rights of medication administration are a set of guidelines to adhere to when administering medications in an effort to reduce adverse medication events. Learn how to ensure proper medication dosages for the individuals you serve with this checklist of 7 questions. Number 1. The right drug. Ensure the correct medication ordered by the medical professional is administered. The right resident. Ensure the correct resident receives the prescribed medication. Number 3. The right dosage. The correct amount of the medication is administered. Number 4. The right route. The medication is delivered in the appropriate course. Number 5. The right time and frequency. The medication is delivered at the ordered time and interval. The right documentation. The medication administration record is signed immediately following administration. Number 7. The right reason. The medication is prescribed to benefit the resident.
Steps to giving medication safely. Always use the 7 rights of medications when preparing medications. The label on the blister pack must be cross-referenced to the label on the medication administration record to the medication in the blister pack at least 3 times. Once before preparing the medication, secondly while pouring and preparing, then just before administration to the resident. Always use the 7 rights to cross-reference to ensure labels match and the correct medication is in the blister pack. For example, ensure it's the right medication for the right resident at the right time and dose using the right route. Also ensure the medication is given for the right reason. Check the medication label on the medication administration record to ensure that the proper dosage is given and in the right way prescribed. Medication labels. The medication label on the medication container or blister pack will identify the pharmacy where the medication was dispensed. It will have the following clearly marked: resident's name, name of the medication, dosage, date of the medication was filled by the pharmacy, instructions for storing and administering medication, medical professional's name, and expiry date.
What are the 3 checks in medication administration? If you're a nurse or someone interested in the safety protocols of medication administration, you're probably wondering about the critical checks that ensure patients receive the right medication. Let's break down these essential steps to understand how medication administration is made safe and accurate. When administering medications, nurses follow a strict protocol to avoid errors. This process involves 3 key checks that are performed at different stages to ensure everything is correct. The first check happens when the medication is removed from the storage or dispensing device, such as a Pyxis or MedCart. Here, the nurse compares the medication label with the information on the medication administration record, MAR, to confirm the right patient, right medication, right dose, and right route. This initial check is crucial because it sets the stage for the rest of the process. The second check occurs after the medication has been prepared for administration. The nurse again compares the medication label with the MAR to ensure that the right medication, right dose, and right route are still correct. This step is often overlooked but is vital because it confirms that the medication has been prepared correctly according to the prescribed orders. The third and final check takes place at the patient's bedside, just before administering the medication. Here, the nurse verifies the patient's identity using 2 identifiers, such as name and date of birth, and then checks the medication label against the MAR one last time to ensure the right patient, right medication, right dose, right route, and right time. This final check is the last safety net to prevent any errors. Each of these checks is designed to prevent common mistakes, such as giving the wrong medication or dose, administering it at the wrong time, or using the wrong route. By performing these 3 checks, nurses can significantly reduce the risk of medication errors and ensure patient safety. Additionally, it's important to note that these checks are part of a broader set of rights that include the right patient, right medication, right dose, right route, and right time. Some guidelines also include additional rights like right documentation and right to refuse, which further enhance the safety and completeness of the medication administration process. By following these 3 checks diligently, nurses can provide high-quality care and maintain the trust and safety of their patients.
Steps to follow when preparing medications. Number 1. Complete hand hygiene. 2. Confirm allergies, changes in resident's condition, or changes in medications. Review medication change form, if applicable. Check resident's name, medication name and dose, route, time and frequency of administration of the medication to be given on your MAR, medication administration record, using the 7 R's. Know the side effects and adverse reactions of the medications you are giving. If you are unsure, check the pharmacy fact sheet, contact your pharmacist, the resident's medical professional, the community health nurse, or health line. Check the label on the container and the expiry date. When administering the medications to the resident, staff must confirm resident identity prior to administering medications. Always use 2 identifiers every time. Identifiers may be name, date of birth, confirmation of identity from photograph on medication administration record, or confirmation of identity from another colleague. A resident may not always be able to tell you their name and date of birth. Administering the medications to the resident. When the resident receiving the medication has been identified, ensure the resident is sitting to prevent choking. Provide resident with water or juice to take the medication. Watch the resident swallow the medication and ensure all has been swallowed completely. Observe the resident for adverse reactions. Perform hand hygiene. Sign your medication administration record immediately. Ensure medications are returned to your medication cabinet and locked. Complete all steps above prior to administering to the next resident. Signing the medical administration record immediately is crucial for resident safety. A medication administration record is a legal document and can be used in a court of law. If a medication is not signed and it is assumed as not given, even if it was given. If a resident is urgently transferred to the hospital without the MAR being signed, the resident is at risk of being double dosed and/or given a medication that interacts with the medications they have received. Practical overview of medication administration. When administering medications, first you begin by washing your hands and ensuring you have gathered all of your supplies, med cup, water, applesauce, etc. Ensure you have read ShareVision and any medical appointment summaries that are relevant. You will be required to ensure you have a quiet space and time to do the medications. For example, do medications during downtime. Ask your coworker to assist in engaging residents if needed, or if you work alone, explain to your resident you are going to do meds and there needs to be quiet time. Unlock the medication cabinet and take down the MAR binder, blister, and any other medications for the first resident you will be giving medications to. Using your 7 R's, cross-reference the label on your MAR to the label on your blister to the medications in the blister pack. Check for any medication changes in the binder. Remember, you must do 3 checks. As you begin to prepare the medications and punch the medications out of the blister pack, complete your 7 R's for the second time. Prior to giving the medications to the resident, you will complete your checks again. Identify your resident using two identifiers, name and picture on the MAR, or verification from your coworker. After the resident has taken their meds, ensure they are sitting up, provide water, and engage in conversation to ensure all medications have been swallowed. Sign your MAR sheets immediately and lock up all medications in the cabinet. Start process for the next resident if applicable. Overview. 6 steps to administering medications safely. Number 1. Use the 7 rights of medications when reviewing medications. 2. Read the medication label on the container or blister pack. Step 3. Record the medication. Step 4. Observe, evaluate, and report. Step 5. Store medication in a safe place. Step 6. Be aware of any residents who self-administer.
This concludes the Medication Administration Refresher Training for Module 3. You will be required to complete a test at the end of this slideshow. This can be located on ShareVision in the training section.